autism, right? Yeah, let's do the autism. Okay, let's do this autism topic. So, let's discuss about autism. What is autism? Autism means spectrum disease, right? God, what is happening? This history, okay? It's a spectrum disorder, right? It's a neurodevelopment condition with onset during the early development period. Autism spectrum disorder affect the way of communication and interaction with the environment. So here, in here, people with this condition can have very different abilities and challenges. Many people with autism spectrum disorder have uneven profile of abilities, right? So different autism children is having they have different prominent symptoms, right? That's why we call autism spectrum disease. So autism spectrum disorder likely have multiple causes. Twin studies strongly support the genetic factors and identified genetic conditions like Fragile X syndrome, tuberous sclerosis, associated with 10 to 37% of the causes. And there's no evidence to support the theories that immunization or parenting style cause the autism. So usually, mostly it's support for the genetics, right? Yeah. Then around 1% of the population has an autism spectrum disorder, with estimate ranging from 70 to 1 in 150. Sorry, 1 in 70 to 1 in 150. Then, estimating prevalence of autism spectrum disorder complicated by under-recognition and under-diagnosis in adults. And more children with autism spectrum disorder are present into services. Then, okay, it took like they are giving the epidemiology and everything. Okay, let's discuss about the clinical features of autism spectrum disorders. What is it? What is the problem? Does it mean tics occur less than 6 months? Yeah, usually, uh, actually, doctor, it's not mentioning in the therapeutic guideline. Okay, but in the when we are considering these two and to differentiate, usually tics present less than 1 year. Okay, less than 1 year. But if after tick symptoms present in like more than 6 years, they are mentioning to consider about Tourette. Okay, but usually the tick symptoms present, you can remember it as less than 6 months or less than 1 year. Okay, because even uh, there was no therapeutic guideline ticks part. When I was preparing, and I used the not the guideline. Actually, I used the internet, the Google some article, and they have mentioned about that. Usually about the time duration in the ticks, it's less than 1 year, and for the Tourette syndrome, it's in the therapeutic guideline also. It should be more than 1 year. Okay, so don't confuse these two. Usually, ticks are, you can remember it as even less than 6 months or less than 1 month. Okay, there's no specific. Anyway, uh, it can't be more than 1 year. Okay, so less than 1 year. You can remember like that. Yeah. Hope your like doubt is clear, because recently they have updated about these ticks and they have mentioned like that. Okay. Because in teaching also they haven't mentioned anything about the time duration. They are telling the consider more than 6 months as the tolerate, because like after 6 months we can like wait for more 3, or like if the patient is presenting 8 months of symptoms, okay, 8 months of symptoms, and we have to diagnosis, then we can wait 4 more months, like thinking if like more than 1 year, because 8 months then 12 months, that means 1 year, and thinking about the Tourette syndrome, right? That's what they are mentioning. Here, what are the characteristics of autism? Let's go back to our topic. Impaired social communication and interactions across the multiple contexts, like deficits in social, emotional reciprocity, non-verbal communication behavior for social communication, developing, maintaining, and understanding relationship, and the restricted repetitive patterns of behavior, interest of activities like stereotype or repetitive motor movement. So give me a good example from recalls. If you are like familiar with recalls, give me a best example for autism child. What about my recall class doctors? You should know this, right? Do you remember it? Dr. Bhagya and Dr. Ritik. Tell me once. Yeah, arranging doll, right? That's a very famous recall, right? Yeah. Okay, so okay, I will give a good example. Okay, so usually AMC used to give some scenario. A girl is arranging doll again and again, the repetitive action, and they are interested in one activity. Okay, this child is interested in arranging the dolls again and again. Okay, like that. That's a very famous AMC question. And I have to mention one more thing. I'll explain it from here. Okay. And repetitive motor movements or use of objects of speech, instance of sameness, highly restricted fixation, fixed interests that are abnormal in intensity or focus. In that case, also, our small girl has the fixed interest on dolls, right? Yeah, and intensity of focus, hypo or hyperreactivity to sensory stimuli. The diagnostic criteria require that these characteristics must have been persistent since the early development period and must cause the clinically significant impairment in social, occupational, or other important areas of current functioning. Okay, so you should remember here. These must have been present since the early development period and must cause clinically significant impairment in social, occupational, and other important areas. So, and we have red flags for autism disorders in children and adults. So, what are those? Here, um, these are does not bubble, point, or making meaningful gestures by the age of 1 year, and does not respond to their name by age of 1 year. Avoid eye contact. Okay. Usually in the therapeutic guideline also they are giving this avoid eye contact, but it's a red flag only, right? In they used to give in recalls, they used to give that the doll question, okay, the doll question, and they specifically mention patient is having a good eye contact. Okay, because if you're like if you thoroughly follow this one, okay, if in our mind, if the patient is like in autism, if we thoroughly follow this one, it must be patient must avoid eye contact. So in that case we can think something else, right? But this is a red flag only. Okay, this is not we can't find this avoid eye contact in every cases. Okay, this is not in every case. Some children with autism has a has good eye contact. Okay, so in that case, so like don't blindly follow this one. Okay, so you have to think about it. Not every children present with this symptom. Okay, the next one has delayed speech and language skills. Play lacks play lacks the variety or make believe that is appropriate to their developmental level. Flap hands, rocks body, or spin in circles. Wants to be alone. Repeat word or phrases over and over. We call it echolalia. And gets upset by minor changes and has obsessive interest. Okay. Yeah, give me 1 minute, doctors. In here, okay, yeah, sorry, we have a side. Yeah, repetitive words or phrases over and over and gets upset by minor changes and has obsessive interest and gives unrelated answers to the questions and has trouble understanding others people's feeling or talking about their own feeling. So these are the red flags. Okay, that doesn't mean in every cases this everything should be present. Okay. Mm, okay. Okay. Those are the red flags. Mhm. Then, here girls are more often able to camouflage behavior and copy a social skill from peers and may be more dreamy, distractible, and creative compared with boys with autism spectrum disorder. The interest of girls with autism spectrum disorder can be similar to their peers but more intense. Then the severity of autism spectrum disorder can vary. DSM-5 has defined 3 levels, ranging from level 1, require supporting, to level 3, require very substantial support across the each diagnostic domain. When supports are not in place, a person with level 1 severity autism spectrum disorder will have noticeable impairments, while a person with level 3 severity spectrum disorder will have severe deficit. So that means they have a level. DSM-5 has defined in 3 levels. Okay, 3 levels, and even in level 1 start require the supports and level 3 require more support, like that they are mentioning the same thing. Then autism spectrum disorder may accompanied by intellectual impairment, language impairment, clinical features of a non-medical or genetic conditions or environmental cause, and another neurodevelopment or psychiatric or behavioral disorder or catatonia. So, surveillance for autism spectrum disorder. 1 minute, doctor. Sorry for that. I'm not in home, doctor. Yeah, there's a cute dog can come and like he tried to. Yeah, he's crying. He's asking for the attention in here. Okay. Here for advice on developmental surveillance and general assessment of development delay and disability. Here, okay, yeah, and this is the surveillance because for the autism disorder we don't have any treatment, right? You can read this later. Then what about diagnosing autism disorder? Here, facilitate diagnosing persons with suspected autism disorder be alert for red flags. We know what are the red flags, and perform medical evaluation to exclude medical causes for the presenting problem, like hearing impairment, right? Yeah, those are the things. And here they have mentioned a functional assessment. Here they have mentioned we have to do the assessment. In here, a functional assessment may facilitate access to the these NDIS for funded early intervention in children under 7 years, and is useful to guide management in older children. Sorry for the background noise, doctor. And young people and adults. The confirmation of formal diagnosis of autism spectrum may be need in children over 7 years to access funded support. So here you don't have to remember these things, but remember the criteria. Okay, uh, should we have to, because in here also there's no specific criteria, but they have mentioned something about red flags and performance. We should evaluate and exclude other symptoms. Then refer the person to a health professional with expertise in assessment of behavioral and neurodevelopment conditions for more details in health and medical assessment. So support the individual, their family and carer through the diagnostic process. So, yeah. So this, because the treating of the autism is multidisciplinary process, right? We need GPs, developmental pediatrician, psychiatrist, psychologist, occupational therapists, because it's multidisciplinary action. So here, yeah. Then let's discuss these are the something that you can read, like common health problem, epilepsy, seizures, constipation, right? Let's discuss the how we should um, treat this patient. Okay. Yeah, management of people with autism spectrum disorder. There's no cure for the ASD, but there are evidence of support to use the intervention that can address some core features. So here, uh, for a person with autism, the general practitioner should assist in identify and refer the appropriate specialist. Okay, that's why I told you this is a multidisciplinary approach. Then provide support and evidence-based information of the patient, family. Okay, like that. Then, yeah. Then the treatment. No single treatment approach is suitable for all people with autism spectrum disorder. But we have to do the multidiscipline, right? Psychological interventions, then communication, social communication interventions, and so role of drug therapy. And here the psychoeducation, and we can refer for the speech pathologies. So it depend on the different features of different autism cases. Okay, and the role of drug therapy and complementary therapies. There's no evidence to support the use of medication, exclusion, diet, or any other biological treatment for the core symptoms of autism. So, although the drug therapy does not address the underlying cause, it can be considered for challenging behavior like agitation, aggression, or comorbid psychiatric disorders. Okay, for general advice, pharmacological management of anxiety, because these people are presented with agitation, anxiety, and sometimes it can be comorbid with other psychiatric disorders. So in that case only we can go with drug therapy. Otherwise we can't, like there's no rule of drugs for the autism disorders. It's a multidisciplinary approach. For each symptoms, like if the patient is having speaking problems, we can refer for the speech pathologist like that. Okay. Yeah, that's all for this because there's no need to discuss these things. Like you can just read it, they're not important. So usually you should know the basic things. Okay. Yeah. Here we have discussed the common problems and these problems, like other comorbidities, in that case, if the patient is as a presenting constipation, we have to treat them, right? If the gender dysphoria, we have to treat obesity, we have to treat them. But like if they're asking something for the single best answer for the autism, there's no such kind of cure for the autism, right? So that's all for the autism. If you have any questions, you can just ask, or we can do some questions for this. Give me 1 minute. Uh, yeah, I'll select the questions from here. We will do like 3 or 4 questions. Then we will stop the class. Okay? Because I have a dinner yeah, in my mom's friend's place. Yeah, I have to go and talk with him, right? Because like after long, I came to Sri Lanka. Yeah. And, okay, and wait 1 more minute, doctors. I'm selecting. Okay, let's do this question. Okay, so first one is a 28-year woman present to the GP clinic with concern about difficulty to concentrating at work and disorganization in her life. After comprehensive assessment, she is diagnosed with ADHD. She has no significant medical history and take no regular medications. On examination, she appears well, and you are considering prescribing stimulant medication as part of her treatment plan. Which one of the following should be performed prior to commencing stimulant medication in this patient? So, what do you think? Type your answers in the
See,
chat. Okay, let's check your answer. Yeah, you are correct. Now you know why, right? Like all other doctors also agreed, right? Uh, before starting stimulant, we have to consider about the cardiovascular system, right? We have to check the blood pressure, heart rate, right? Even in some cases, we have to do the ECG as well. Yeah. The combination provides the comprehensive evaluation of cardiovascular status, which is essential because stimulant medication can have cardiovascular effect, including high blood pressure and tachycardia. A 6-year-old boy present to the GP clinic with his parent who is concerned about his behavior at home and school. He has no significant medical history and take no regular medications. His immunizations are up to date. Parent report that he has always been active child, but his kindergarten teacher says he is constant fidgeting and leaving his seat and interrupt the class at home. He loses his toys, forgetting instruction, and cannot seem to finish tasks. He had some speech delay, but otherwise met his developmental milestone. There's a family history of learning difficulty. On examination, he appears well with vital signs within normal limits, and he appears restless but cooperative and not dysmorphic. He's in the 50th percentile for height and weight, which are not finding required to make the diagnosis of ADHD based on Australian guidelines. So, what is it?
12 months.
Are you sure for ADHD? Okay, most of doctors are going with E. Let's check.
No, 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 ma'am. No, ma'am. No, ma'am. It's symptoms present in at
Yeah,
least
at
two
two
settings.
setting, right? Yeah, yeah. Okay, so don't confuse, okay? Yeah, yeah. This is the main. I'll show it again, okay? So don't forget the criteria here. It should be present before age of 12. My God, this therapeutic guideline is never a user friendly. Okay, here this is age before age of 12, okay, not 12 months, and at least for 6 months, not 12 months, and this should be at least in two setting, home and school. Now you see, right, these two are very important to know, right? That's what I told you. Even now we show the question, right? Okay. Yeah, I'm not gonna read it again. A 4-year-old boy present to the GP clinic with his mother, who reports she cannot control him anymore. His mother states that he does not pay attention to her and does not follow her rules, such as putting his toys away before watching television. These behavior issues have been ongoing for more than 6 months. She also complained that her son is unable to concentrate on any task lasting longer than a few minutes. For instance, he is unable to finish a meal completely without running up and down in the corridor. The teachers at his preschool report that he is more active than his peers and frequently disrupt the class. He is also very forgetful during the class, and teachers are struggling to make him concentrate. He was born term via vaginal delivery any without any complications. Medical history include acute otitis media 3 years ago. He has no significant medical history and does not take any regular medications. Met all his developmental milestone. Examination appears well with vital signs within normal limits, and the child is able to turn his head and make eye contact when his name is called. However, he does not answer direct questions when he preoccupied with playing with the toys in the office. He often interrupts the conversation between his mother and the doctor and demand to go outside and play. There are no other abnormalities in his physical examination. Which one of the following is most appropriate management? What do you think, doctor? Mhm.
Behavioral therapy.
Okay, let's take your answer. This is ADHD case, right? So initial therapy is behavioral. A 2-year-old boy refers to the pediatrician by his general practitioner due to parental concern about his development. He was born at term after an uncomplicated pregnancy and delivery. He has no significant medical history, and his mother reports that he has had delayed speech and poor eye contact since infancy. On examination, his height and weight are at 50th percentile, and genetic testing reveal deletion of 16p11.2. Which one of the condition is the most likely to be diagnosed with? So, what do you think?
Can you see the top of the question, please?
Yeah, yeah. Okay, yeah. So most of doctors are going with E. So let's say you are correct, right? In here, also patient is having the red flags, right? Here, what are the red flags? Mother report that he had had a delayed speech and poor eye contact since infancy. Yeah, here. So that is it. Then one more question. A 20-month-old boy is brought by his mother to the GP clinic for his routine health check and has no significant medical history and does not take any regular medications. Pregnancy, sorry, yeah, the pregnancy and the birth were uncomplicated. Mother reports that he has mm, met his gross motor milestone but has been slower with language development. He occasionally repeats words and hears but uses few words consistently. He has had history of hearing and vision screened recently as a part of free screening program in shopping center. On examination, he appears well with vital signs within normal limits. When offered toys, he showed limited interest in interactive play. His mother mentioned that he often seemed to be in his own world and is happy to play trains for at least 1 hour alone. Which one of the following mostly diagnosed? So, what is it? Yeah, you are correct. Now you know how it present, right? Hey, the patient. Okay. Why you think this as autism? Why? Give me example from this stem. Give me the example. Like example mean why you think like that. This is autism.
Language development is slow, and he occasionally repeats words.
Then he
Also,
seems
he
to
plays with the trains for long.
yeah,
Means he only focuses on one thing and does it repeatedly.
yeah, and he like to play the trains for at least 1 hour alone, right? He has a fixed interest for these trains, right? Yeah, yeah, good, good. Okay, so now I have to go, doctor. Okay, and there's no questions for Tourette and tics in e-medicine. I just searched it, but I couldn't find. Yeah, 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 correct. You understand the topic clearly. So yeah, that's it, doctor. So we will meet tomorrow, okay? And thank you so much. I have to end the session today. Okay, bye bye. Thank you so much.